Now, this topic is metabolic acidosis. Metabolic acidosis is a disease during which body fluid has more acid. These, if the pH decrease and in the same direction bicarbonate ions are also decreased, then it is metabolic. If bicarbonate ion decrease and pH of the body fluid also decrease in the same direction, then it is metabolic. And because pH is decreasing, so it is acidosis, metabolic acidosis. Now come to the causes of metabolic acidosis. These causes are excess acid production. If body produces more acid due to any disorder, then loss of base occur because of diarrhea, due to body fluid are lost during diarrhea by base, which is especially bicarbonate ion is lost. Then occurs diabetic ketoacidosis, then lactic acidosis, more acid is formed, starvation, ketosis, ketone bodies are formed, diabetic disease, kidney disease, and also there are other causes. Also, this occurs in normal anion gap, which is 8 to 12 milli equivalent per liter. 8 to 12 milli equivalent per liter. Now, what happens during normal anion gap? These cases are hyperalimentation, and Addison disease, renal tubular acidosis, Metabolic acidosis also occurs when anion gap is increased, and during anion gap increase, these cases are increased anion gap, and these disorder are: one is methanol uremia, diabetic ketoacidosis, propylene glycol, iron tablets or isoniazid, lactic acidosis. These causes increase in anion gap and also causes metabolic acidosis. Now come to the sign and symptoms of metabolic acidosis. First occurs CNS depression, then heart dysrhythmias due to high extracellular potassium ion. Heart dysrhythmias occur due to high extracellular potassium ion. Now come to the decreased cardiac contractility, decreased stroke volume, hypotension, and ketosis. These are the signs and symptoms of metabolic acidosis. Now come to the point of compensation. During compensation, in first line of defense, during this first line of defense, body will produce more base. During, according to the equation in which H2O plus CO2 will give H2CO3, the reaction will go toward the side which has more basic form to produce more base. फर्स्ट लाइन ऑफ डिफेंस में बॉडी का ऐसा मैकेनिज्म काम करेगा कि बॉडी मोर बेस प्रोड्यूस करेगी, और इस दौरान जो मोर एसिड बनाए वो उसे न्यूट्रलाइज करने के लिए ज़्यादा से ज़्यादा बेस बनाया जाएगा। और जो दूसरा यानी सेकंड लाइन ऑफ डिफेंस है वो है रेस्पिरेटरी मैकेनिज्म। सेकंड लाइन ऑफ डिफेंस, during this mechanism respiratory system will hyperventilate so that more carbon dioxide must go out and acid content of the body must decrease. And now come to the third line of defense. This is the third line of defense because it is metabolic acidosis. So this is required, more base is required, so loss of base from the body must be prevented. And it occurs that kidney will prevent excretion of base and produce more base. Also, the treatment is that the patient is injected with sodium bicarbonate. Patient is injected intravenously with sodium bicarbonate, this is base, sodium lactate, this is the salt of base, and sodium gluconate. This was the treatment of metabolic acidosis, and this is the most important topic in nursing